Do you sometimes notice small red or purple spots on your skin during pregnancy? Or maybe you've felt unusually tired or bruised easily. These could be signs of something going on with your blood, like a condition called gestational thrombocytopenia. It's actually more common than you think. About 1 in 10 pregnant women develop this condition. It happens when the number of platelets in your blood, which help with clotting, drops during pregnancy. But here's the good news. For most women, it's mild and doesn't harm the mom or baby. Think of platelets like tiny band aids in your blood that stop bleeding. When there are fewer of them, your body might take longer to clot. But don't panic. In most pregnancies, this fixes itself after delivery. So what causes this drop in platelets? Well, your body goes through amazing changes during pregnancy, and some of them affect your blood. One reason is that your blood volume increases by almost 50%, but your platelet count doesn't increase at the same rate. This makes the platelet count look lower even if they're working fine. Imagine diluting a spoon of sugar into a glass of water. It's still sweet, but less concentrated. Also, your body naturally uses up platelets faster during pregnancy because it's preparing for childbirth and possible blood loss. Another reason, hormones. They affect how your bone marrow, where platelets are made, functions. But unlike some serious diseases, this doesn't involve the immune system attacking your platelets. Most importantly, no single cause fits all. It's a mix of normal pregnancy changes. Now here's the tricky part. Many women with gestational thrombocytopenia feel totally fine. In fact, most only discover it during a routine blood test. But some might notice signs like easy bruising. Maybe you bump your leg on the coffee table and end up with a big bruise. Or tiny red or purple dots on your skin, especially on the legs or arms. These are called petechiae. Think of them like tiny paint splatters that won't wipe off. You might also have longer nosebleeds or bleed longer when you cut yourself. But here's a key clue. You probably won't feel weak, dizzy, or have heavy bleeding. If you do, it might be something else. So ask yourself, have I been bruising more than usual lately? If yes, talk to your doctor, but don't jump to scary conclusions. How do doctors know it's gestational thrombocytopenia? It usually starts with a simple blood test called a CBC or complete blood count, which checks your platelet levels. If your platelets are slightly low, usually above 70,000 to 150,000 per microliter, and you're pregnant with no other health issues, it's likely this condition. To make sure, doctors will rule out other causes like infections, lupus, or preeclampsia by asking about your history and doing more tests. The best part, most women don't need any treatment. Since it's mild and goes away after birth, the main plan is watchful waiting, like keeping an eye on a small leak in a boat that might seal itself. Doctors check your levels again before delivery to ensure it's safe for epidurals or C-sections. If platelets drop very low, they might suggest extra care, but medication is rarely needed. Good news, you can't catch gestational thrombocytopenia like a cold. It's not an infection. And since it's tied to normal pregnancy changes, you can't fully prevent it. But you can support your body to stay strong. Think about it like charging your phone. The better you charge it, the longer it lasts. Eating a balanced diet rich in iron, folate, and vitamin B12 helps your bone marrow make healthy blood cells. Foods like spinach, beans, eggs, and lean meat are super helpful. Stay hydrated and avoid medications like aspirin or ibuprofen, unless your doctor says it's okay, because they can affect platelets. And keep going to your prenatal checkups. Catching it early means peace of mind. Ask your doctor, should I have my platelets checked again? Being proactive is the best prevention. While gestational thrombocytopenia isn't usually dangerous, scientists are always learning more. Recent studies show that even mild drops in platelets can be tracked earlier using advanced blood tests. Some researchers are looking into whether gut health or inflammation plays a role. Cool, right? In one 2023 study, doctors followed hundreds of pregnant women and found that those with slightly lower platelets still had healthy deliveries, reinforcing that it's mostly harmless. New guidelines now suggest less frequent testing if no symptoms appear, reducing stress for moms-to-be. And telehealth is helping pregnant women in rural areas get blood test results faster. Technology is making this condition easier to manage without extra worry. The big message: science is helping us treat pregnancy with more care and less fear.